Okay. So this is my dad, Dr. Mark Pollard. He works at Cooper Bone and Joint Institute at Cooper University Healthcare. He's an orthopedic surgeon and he actually operates on people. And I just had a few questions about some of the biggest injuries in sports right now. So about a week or two ago, Christian McCaffrey, who started the year with bilateral Achilles tendonitis in both of his ankles, I think it was. He actually suffered a PCL tear. So that's put him out for the rest of the year. Just wondering if this is going to be like a long-term thing with the tendonitis and the tear, or like what you think he's going to do next.
It depends. Like if it's just the PCL, that's one of the major ligaments inside the knee. It's right next to the ACL. It's injured far less commonly than the ACL is, but PCL injuries don't always have to have surgery. Sometimes you can let them kind of heal and the people can rehab them. And I think that was the route that Christian McCaffrey and his team was taking. So it could be a long-term thing, but there's many instances where athletes have had a PCL injury and they were able to go on to have good careers. I think Reggie Bush is one prime example. He hurt his PCL early in his career, and he ended up having a very, very nice career after that.
Yeah, and then with the tendonitis, is that going to be a long-term thing, do you think? That he'll have to deal with?
That, that's difficult to say. The tendonitis is, chronic inflammation in his tendon, specifically his Achilles tendons. And so hopefully that settles down, but tendonitis can tend to be a recurring and chronic entity. So that's something to keep an eye on moving forward, I would say.
Yeah, definitely. And then my next question is about Joel Embiid. So he's had a lot of problems with his knee. He's torn the same meniscus multiple times. He's hyperextended it. There's swelling again. It's coming and going. But for him, like, do you think he should do anything in specific, or do you think it's going to be something that he'll have to deal with for like the rest of his career too?
It's difficult to say. Some of the signs and some of the clues that have been given out are a little worrisome. The fact that he's had, I think, surgery on this knee two times for his meniscus,
Yeah.
and he's still having problems with it, I think is worrisome to say the least. Um, and also, the knee is getting swelling periodically with activity. So that's indicating that there's something going less than ideally inside the knee. This is something he's going to have to, manage, and the team and everyone is going to have to manage moving forward. And it's, they're not always forthcoming in telling you what exactly is going on with the injuries and so forth. So it's difficult to uh, kind of predict what way this is going to go.
Yeah, definitely. And then one more question. So this past Sunday, the Eagles played the Panthers. And during this game, Jonathan Brooks, the rookie running back for the Panthers, he was already rehabbing from his ACL tear from the end of last year at college. And he ended up getting held out for the first like 8 or 9 weeks about because the team wanted to make sure he was like 100% ready to come back again. But then unfortunately, like only like a few weeks after they brought him back, he ended up tearing the same ACL again. So that's two ACL tears in less than a year. So is it like looking really murky for him for the future? For like when he eventually does have surgery and come back next? Like, is there any chance that he could be the player that we saw at college ever again, or do you think it's going to be hindered from now on from like these two surgeries he had?
It's very difficult to come back from an ACL, and oftentimes your best chance is your first chance after the surgery. A subsequent, if you tear the graft and then you have to have revision ACL surgery, the results aren't as predictably good as with the first surgery or the primary ACL reconstruction. So, yeah, it's going to be much harder for him to come back and get back to the previous level after the revision surgery than it was after the first surgery.
Okay. All right. Well, thanks everyone for watching this. And